My name is Lynn. I use she, her pronouns, and I'm presenting my capstone project for Ada Developers Academy Cohort 18, titled Veterinary Anesthesia Protocol. I was a veterinary nurse and nurse manager at high volume specialty, emergency, and surgery practices. One of the biggest complaints from medical staff was a lack of good usable tools that would make their job easier and increase the probability of positive outcomes for their patients. I decided to use my experience in veterinary medicine and my newly acquired knowledge in full stack software development to build a simple yet valuable tool that can benefit medical staff, pets, and pet owners. The Veterinary Anesthesia Protocol web application calculates drug dose volumes required for veterinary anesthetic protocols. It's an application whose primary users are the doctors and nurses implementing those protocols. The reason I chose this concept for this app is because common tools in use today are highly prone to user error. So what are the problems with the common tools currently in use? First are dosing charts. The obvious problem here is the potential for visually scanning the wrong information and making transcription errors. They also don't offer precise enough dosing for the smallest patients. Next are Excel spreadsheets, which have the capability to automatically calculate drug doses just by entering a patient weight. And while this is an improvement, it can't capture all possible calculations of the many options available for anesthetic protocols. For this reason, many drugs are still manually calculated when using this tool. Last, and I think probably the most common of all of these tools, is blank forms and manual calculations using a calculator. It's very easy to miss a decimal point when punching numbers into a calculator, which can result in overdoses by 10 to 100 times a normal patient dose. So what does this app do? The primary function allows a doctor or nurse to enter patient information and request specific drugs and doses for that patient's weight. The app returns and displays each drug and its calculated volume. In addition, the app calculates fluid rates, emergency drugs, and a pain continuous rate infusion for pain control. The app features a healthy pet option to auto-populate the drugs for the anesthesia protocol for routine surgeries like spays, neuters, wound repairs, and maybe to have their teeth cleaned. Finally, the app returns the possible drug interactions associated with the drugs requested for the protocol and all the drugs administered to the patient in the prior 12 hours. Let's take a look at how it works. The app opens to an empty form where a user can start to enter patient information, and I'll use my pet Luke. He's a dog, and species is important here because the calculations are different for cats and dogs, and he's a 5-year-old male neutered hound mix, and he weighs about 30 kilograms. The weight here is also a requirement because all of the functions of the app depend on the individual weight of the patient. Next, the user can start to enter the individual drugs for the protocol that they would like to use for the anesthesia. The list of drugs available comes from a database in the back end, and this database could potentially hold hundreds of drugs. This would eliminate the limitations of only capturing some of the calculations that you find with Excel spreadsheets. And you can just start typing a drug name, enter a dose, and continue to add all of the drugs that you would like to use for your protocol. The drugs are laid out in sections by the function of their use, and so the user can clearly see what each drug should be used for. And then at the bottom, there's a space for you to enter the drug, any drugs that the patient might have received in the 12 hours prior to the anesthetic event. So you would submit this protocol, and what the app does is it returns the calculated volume for each of the drugs that you requested in the protocol. It also returns the route of administration and possibly some additional instructions here for administering that drug. In addition, it calculates the fluid rates based on the patient's weight. It also calculates a pain continuous rate infusion, and then all of the emergency drugs that might be required if the patient were to go into cardiac or respiratory arrest. Down at the bottom, it returns the interactions of the different combinations of pairs of drugs requested in the protocol and those drugs that the patient might have taken 12 hours prior. And let's take this first interaction as an example of how this might be useful. Cefazolin may decrease the excretion rate of hydro, which could result in a higher serum level of hydro. And so you might take that information and go back up to where you specified the dose for hydro and change it to the lower end of the scale for a normal patient dose for that. You would hit submit protocol again, and that would recalculate your volume so that you could limit the complications of the interactions between those two drugs. Once you're done with a patient and ready to move on to the next one, you can simply click New Patient, and that clears out the form for you to enter a new protocol for the next patient. And let's enter a cat. Cats are about 9 pounds or 4.5 kilograms, and let's pretend that this cat is coming in for a routine procedure, let's say cleaning its teeth, and all of its blood work is normal and it's a pretty healthy cat. You can then use the Healthy Pet Protocol button, which would auto-populate the drugs for a protocol, and then you could submit that auto-populated protocol, and it would do all of the same calculations and pull all of the same drug interactions as if you entered the different drugs manually. When you are done with that patient and want to move on to the next, just hit New Patient and you're ready to go. Future enhancements for this app include adding user login and authentication to make the following enhancements possible, allowing an admin user to create their own protocols for the auto-populate feature, the ability to store generated protocols by patient to be retrieved for future use or to attach to patient records, a printable document of a fully generated anesthesia protocol for use while monitoring anesthesia in the operating room, and finally, adding accessibility enhancements so the app is available to all potential users. My biggest lesson in the making of this app is not to be afraid of new technology. I was worried about the amount of time it would take to learn a totally new technology, one that would be the structure of my entire back end. I didn't think I would have time to learn something so big and new and still create an entire app from a blank page in the very short time allotted for Capstone. But because of my prior knowledge with Flask, I was able to quickly understand the differences and create the start of my backend within a day. I also found a few surprises that actually made the new tech easier to understand and use. I'm sort of mad at myself for not pushing myself to explore Django's front end capabilities, but I know not to be afraid the next time. This is some legal stuff that's important for you to read if you want to use this app. And then if I could just say a quick thank you to everyone here at Ada Developers Academy, all of our talented instructors, all of the volunteer TAs, mentors, and tutors, the Ada alum community for sharing their experiences and lessons learned to help our cohort along, my peers here at Ada who have been so generous in their help and support, and then special thanks to Jay for managing my ups and downs, wins and losses over the past 6 months with grace and never-ending support. Thank you for watching.